For my presentation today, I'm going to first give a brief overview of the control program that we have launched here in Atlantic Canada to control Johne's disease. And then I want to give an overview of where our research project is to date as far as our research outputs and where we plan to go with the research to look at how effective and the AGDI program has been, how well it has been taken up by the producers and the veterinarians, as well as the adherence of our program recommendations on farm. In the past number of years, Johne's disease has been a very hot topic in our media, both agricultural media and our regular media. This has been especially so when other provinces in Canada has started their own Johne's disease control programs. Because of this, in 2009, a forum of industry leaders in the dairy industry in Atlantic Canada did meet to discuss Johne's disease impacts potentially in Atlantic Canada and to decide if there would be a specific need for having a control program specific for Atlantic Canada for Johne's disease. This forum did identify 4 main reasons why they felt it would be important for Atlantic Canada to have their own Johne's disease control program. The top reason that has been identified is that Johne's disease does cause economic losses for the dairy industry in Atlantic Canada. The other 3 big concerns that the forum identified was the risk of spread of Johne's disease to our area for cattle movements, maintaining our competitive market access for our good genetic stock here in Atlantic Canada, as well as to maintain and protect food safety from our milk production. With this in mind, the Atlantic Johne's Disease Initiative was designed and launched here for Atlantic Canada with the goal to reduce the prevalence of Johne's disease in our area. This program was designed with 3 main pillars of importance, and that was to educate about Johne's disease, to manage the infection and spread of Johne's disease, as well as to continue to do further research about Johne's disease in our area. In June of 2011, this program was launched. This started by the release of our website, as well as doing direct mailings to the dairy producers of the region and media reports on the agricultural side as well as the general media. At the bottom of the picture here are an example of 4 of our different mailouts that we did to our producers, and we certainly tried to have things that would be a little bit more eye-catching, so certainly cow patties with Johne's messages as well as information on the back was our goal to catch attention and to draw people's attention and interest to this area. Specific educational efforts were made directed at our veterinarians in our area. By telephone, every veterinary clinic in Atlantic Canada that had food animal clients was contacted by telephone to inform the veterinarians of this control program and to help recruit veterinarians to volunteer to participate in the program and become certified by an advanced training Atlantic Johne's Disease Initiative program. The goal was to have at least 1 veterinarian from each of these clinics that had food animal clients to become certified. And I'm pleased to say that we've exceeded that goal and actually have 47 certified veterinarians for the region. Dairy producers were also specifically targeted for education, and this was done by seminars at different dairy producer meetings, on-farm seminars, as well as continuing education with our certified veterinarians. The second pillar of the program to control the prevalence of Johne's disease was split into 3 main phases. The first phase is called herd categorization, and this phase is voluntary and it's fully funded. In this phase, environmental cultures that have been tested and verified by Kerry are used to categorize the herd as environmental culture negative or environmental culture positive. These manure samples are collected on the farm by specifically trained animal health technicians, and then they're taken back to the Maritime Quality Milk Laboratory for diagnostics and categorization. Once the categorization has been completed, the results are delivered via only the certified veterinarians. At the time that they deliver the results to the herds, the veterinarian does a farm-specific risk assessment with that farm, and then they also design a management plan to control Johne's disease on that farm. This phase of the program is also fully funded, and if a herd is categorized, this part of the program is mandatory. The third phase of the program is for any herds that have been categorized as environmental culture positive, They have the option, in consultation with their veterinarian, of submitting individual cow samples from all the lactating cows in the herd to undergo individual Johne's disease diagnostics. Again, these results are delivered to the herd via the certified veterinarian, and at that time, in consultation with the veterinarian, management plan decisions can be made. The research part of this program is still ongoing. But so far, for the first year of our program, our goal was to have 50% of the Atlantic Canadian dairy herds voluntarily participate in the program. This would be a target of 347 herds. And as of May 5th, we have exceeded that goal. We actually have 375 herds. The graph shown here on the slide is a graph that depicts the percentage of the enrollment targets for each of the provinces, as well as the targets overall by location. What this graph shows, for instance, for PEI, is that in PEI, our first year target was to have 99 herds register for the program. We've actually had 105 herds register for the program. Therefore, they've exceeded their first year target and so have 106% of their first year target reached. Of the herds that have been enrolled, so far we have 282 of them sampled. The herds that are sampled, again, the samples are being collected by a specified third party who is trained to collect the samples. We use a third party who is very well trained for a number of reasons. One is to make sure that the prescribed protocol is followed very closely. And this is the similar protocol that was based on for Carey's research, which is based on the USDA protocol. From Carey's research, it was found that the sensitivity of this protocol is about 71.4%. This protocol has been depicted in the image on the slide, and it is a 3-test procedure. There are the 6 environmental samples that are collected. These 6 samples are brought back, and the diagnostic process is started on the fresh samples. It started by doing a broth culture of these samples. And once the broth culture has been incubated and completed, then an acid-fast staining of the culture is done. If the TREC signals that the sample is positive, or acid-fast organisms are detected in the sample, then these are considered positive samples that need to be confirmed by PCR. If the PCR confirms these samples as positive, then the sample is declared positive. On a herd, out of all of the 6 samples that are being collected, if even one of the samples is diagnosed as positive, then the herd itself is categorized as being positive. Of the herds that we have enrolled and sampled and categorized so far, 42 of those herds have been categorized as being positive by environmental culture. We've also had a fair range in the breakdown of the proportion of their environmental culture samples for each herd that are positive of the 6 samples that we've tested. As Carey's research has indicated, we do also see a fairly strong association between the proportion of environmental samples that are positive with the within herd test prevalence for Johne's disease in that herd. And from our data so far, it would indicate that about 40% of the herds that we have found to be positive are within our low prevalence herds, which these are the herds that would have 1 or 2 of the 6 samples out of the 6 that are positive for Johne's disease. We have about 45% of the herds which have 5 or 6 of the 6 samples that are positive for Johne's disease, and these would be associated with the higher prevalence herds of having a 10% or higher prevalence of Johne's disease on the test prevalence. Of the herds that we have finished categorizing, about 130 of them have had their tests returned to the herd and have completed the risk assessment and management plan, and that is 63% of the herds categorized so far. For every risk assessment and management plan, a veterinarian consults with the producer, and they agree upon a maximum of 3 recommendations that are going to be done on the farm to try to control Johne's disease for that specific farm. It's very farm specific. The risk assessments are actually different for the environmental culture negative herds and the environmental culture positive herds, with the main difference of emphasis being on biosecurity. Of the herds that have had these risk assessments done so far, 108 of the herds have been categorized as environmental culture negative. 22 of them have been environmental culture positive. Once we know what the herds are as far as their categorization, the management plans consist of a recommendation of best management practices specific for that herd. Of the ramps that we have received so far, this is a list of the 10 most frequent best management practices that we have observed being recommended by the certified veterinarians. And I'd like to just draw your attention to the top 3 so far. By the highest frequency, the number 1 recommendation of all the ramps is that animals are not purchased or brought onto the farm, as this is the largest risk factor for bringing Johne's disease onto the farm. When a recommendation is made for a ramp, the veterinarian also has to rank if they feel that recommendation is the most important, the second most important, or the third of the 3 recommendations made. This recommendation has also been most frequently ranked the most important for the risk assessment. The next 2 recommendations that have been most frequently made are to focus on protecting our calves from adult cow manure that could be potentially contaminated with the Johne's disease bacteria. And this would involve having more than 90% of the calves removed in less than 30 minutes after birth, as well as having our calves being colostrum or milk fed by a bottle or bucket to again prevent ingestion of adult infected manure. This program is designed as a 3-year control program so far from 2011 to 2014, and we certainly hope to continue that in the future. But based on that time frame, our program effectiveness will be evaluated to see if this program has an effect on reducing the cow prevalence of Johne's disease. We are certainly aware that decreasing the herd prevalence of Johne's disease is a long-term farm strategy, and so that's something that we shouldn't be able to detect in this first 3 years. We will also want to evaluate the economics and the impact of Johne's disease on these herds. And we also want to take a more specific look at the producers and veterinarians involved in the program directly, to look at what factors motivated them to engage in the program, to determine their level of knowledge about Johne's disease and control of the disease, as well as to see how different communication strategies between the veterinarians and the producers can influence their motivation as well as their adherence to the program. And I'd like to thank you for your attention today, as well as the many people that are helping out with our project. Thank you.